Now, some pharmacists have expressed concern about the potential impact on data collection for HIV/AIDS due to the introduction of self-test kits. Now, the Ghana AIDS Commission, in collaboration with the Ministry of Health, has launched the HIV self-test kits with the aim of simplifying and making HIV self-testing more accessible. The following report by Citi News is Fauzu Masawudu and read to you by Kwekwe Duama Ansa has more.
HIV and the resulting AIDS have long been global public health challenges. According to data from the United Nations HIV/AIDS program, nearly 40 million people, including children, worldwide are living with this deadly virus. This alarming situation has driven the search for effective solutions. A recent report from the Ghana AIDS Commission revealed an alarming rate of over 16,000 new cases of HIV infections. This concerning trend has prompted the introduction of the HIV self-test kits to enhance the country's efforts in combating the HIV epidemic. However, this move has sparked mixed reactions, with some pharmacists expressing fears about potential disruptions in the collection of accurate HIV/AIDS case data.
One thing that I've always known is that with HIV, the need to gather some information on them, and so if it's being accessible or if it's permitted to have it in the community-based pharmacies, it's not going to help Ghana Health Service to gather their data that they need on that. I mean, such people need to be catered for in their respective centers, just to help the country gather such information. All right. This really needs some confidentiality, and so it needs to be done at the health centers, the hospitals.
I don't really like the idea of people testing themselves, because the reason is that most of the time we are all afraid of HIV, and then we normally want people to go in for the tests independently in a hospital setting. When they get the results, there should be somebody there to, caution them before the results even come in. If it's going to be negative, fine. But if it's positive, the person needs to be counseled, because it actually shakes them. Because we associate HIV with death, but most people don't know that these days there are medicines that can take care of HIV.
Doris Atefua, CEO of Vic Doris Pharmacy, holds a different perspective as she stocks the self-test kits. She highlights the various options available in these test kits and emphasizes the convenience they offer for individuals seeking testing.
The self-test kits, because people can now have access to testing without going to the hospital, where one could just easily be identified as going to a facility to test for HIV. You know the stigma that comes with it. Without going to the hospital, where one could just easily be identified as going to a facility to test for HIV. You know the stigma that comes with it. This one uses the saliva, but there is another one that uses the blood. You know the virus is in the blood, so that one too is available.
The news team also gathered opinions from a cross-section of Ghanaians, revealing diverse thoughts on the matter.
A lot of people wouldn't like it to be like an open thing. Do you understand? So, from my perspective, I think it should be a private thing. So, well, why not? I think I'll be able to purchase it personally. That's it.
Hey, Send me I'm tournament. As I'm checking when I say we HIV and me and as I you grab you come tell and I you grab you come tell. And you release and you come on my penny crown bones of this one.
I don't mind testing for myself to know my status. It's a good thing, so I don't mind doing it.
Meanwhile, the Ghana AIDS Control Program reassures the public that it has implemented mechanisms to effectively track the results of self-test kits users.
So we put in a clear MAE system, which actually links the distribution point, that is the pharmacy, to the client. And then even when the client tests, because of the follow-up services, the current pilot that we're doing, there's a follow-up service so that when this client goes to test, the clients will have access to a counselor, will have a support service. And then through that, we'll be able to know. And so far, what we did, we were able to get some feedback. But we admit that not everybody will give us a feedback.